I want to start off by thanking Drs. Bisson, Snyder, and the programming committee for honoring Lynda Yang for her achievements in peripheral neurosurgery. I knew Lynda for over 20 years, both as a co-resident and co-faculty member at the University of Michigan, and in many ways, she was like a sister to me. You know, it's been about 4 years since her passing, and I, like many others, still I really feel her loss. This is a very good article written by Dr. Upadhyaya on Lynda's life and her achievements. She had many academic and career successes in peripheral nerve surgery. And I'm not going to really talk about that because really Lynda didn't take much pride in her academic successes. You know, she really, honestly, didn't really care about it that much. What she took pride in and what her passions were a brachial plexus program at the University of Michigan, which she started. Really didn't have anything of this type at all, but she started a program, engaged orthopedics, PM&R, plastic surgery, a whole host of therapists, occupational and physical, to start the program and really improve the quality of care for a lot of our patients in Michigan and in the region. It was highly successful and still continues to be a success. And it's really a part of her legacy. Her other passion really was raising up others. If you knew Lynda, she really, really took pride in her mentees. She had a whole gaggle of people around her, not just med students, residents, but also anyone like technicians. I can still think of like EMG technicians she encouraged to change positions because she thought that they had room for growth. And I could remember one particular who became an MP. She took particular pride in that. It really was something that she really embraced. And, you can see all these pictures with people around her. And really, I think that's Lynda's legacy. It's not her academic achievements per se, but it's the people around her that she really encouraged to grow. Really, I can't think of any better person to take this award on her behalf than Whitney Muhlestein, who I had the pleasure of training for her early part of residency. She really was a star in Michigan. Lynda really, I think, took pride in what she did. She's an accomplished researcher when it comes to peripheral neurosurgery, won awards acknowledged by the CNS in peripheral neurosurgery. She's currently finishing her fellowship in peripheral neurosurgery at the University of Utah and will become a faculty member. And I know Lynda would take extreme pride and satisfaction in where Whitney is now and what she's going to do in the future.
Good morning, esteemed colleagues. It is a tremendous honor to share a few words with you today about my teacher, mentor, and friend, Lynda Yang. Lynda was born in Ottawa, Canada, but grew up in Louisiana and Texas. She attended Texas A&M for college before enrolling in the MD-PhD program at Johns Hopkins. She completed her residency at the University of Michigan, where, under the mentorship of Dr. John McGillicuddy, she developed a passion for peripheral nerve surgery. A voracious learner and perhaps a glutton for punishment, Lynda augmented her training with fellowships with Mr. Rolf Birch at the Royal National Orthopedic Hospital in Stanmore, at LSU with Dr. David Klein, and in the Netherlands with Dr. Willem van Ouwerkerk and Dr. Martien Molessi. When Lynda returned to the University of Michigan as faculty in 2008, she had a clear vision, a multidisciplinary peripheral nerve clinic. Starting with just one occupational therapist and a medical assistant, she built the University of Michigan brachial plexus program into a thriving enterprise spanning PM&R, plastic surgery, neurology, electrodiagnostics, anesthesia pain, PT, OT, radiology, kinesiology, and research. Lynda was a tremendous leader, not because she sought the spotlight, but because she so masterfully directed it toward others. In a field where ego can easily take the lead, she never viewed herself as above her team. She consistently and selflessly stepped aside, handing over prestigious podium presentations and prominent authorships so that her mentees could shine. When we tried to thank her for these career-defining opportunities, she would brush off the praise with a simple, enduring instruction: pay it forward. Lynda also lifted us by setting the bar incredibly high. Under her leadership, her nurse practitioner was leading the research projects. Her occupational therapists won national recognition for their expertise. Even her medical assistants were authors on peer-reviewed publications. I remember learning that one of these medical assistants was leaving us to attend PA school. I mentioned it to Lynda, assuming that she would be disappointed to be losing a team member that she had spent so many years training. She didn't miss a beat. She made it clear to me the only time she would be disappointed is if someone in her group wasn't actively working to grow. Above all, Lynda was driven by a profound devotion to her patients, particularly children with birth-associated brachial plexus injuries. At baseline, Lynda was a fiery, 5-foot-tall ball of energy, but our Fat Happy Baby Clinic brought out a special kind of magic in her. She pioneered nerve transfers for this population, developed an innovative postoperative bracing system, and had the remarkable foresight to build a meticulous clinical database from day one. 10 years later, she gave me the keys to the kingdom, access to that data, empowering us to develop evidence-based guidelines for their care. But what truly set Lynda apart was how she made these children feel. She wanted them to know that they were seen. She designed a stuffed elephant named Wimbo with an injured arm. She illustrated a children's book, Off He Goes, to remind them of their limitless potential. She helped launch a summer camp for patients and their families and created before and after surgery calendars, giving anxious parents a tangible glimpse of hope. Every December, she brought in Santa Claus to entertain the kids at clinic. If you only knew Lynda from her CV, you might expect someone incredibly intimidating. She served as chairperson of the FDA's Neurological Devices Advisory Committee, chaired the Division of Peripheral Nerves for the DSPN and the American Society of Peripheral Nerve. She had over 110 peer-reviewed publications, 3 patents, and 3 edited books. She sounds almost unapproachable. But to us, she was delightfully human. She had a massive sweet tooth that ensured our clinic was always stocked not only with people but with donuts and Hershey's chocolates to survive the inevitable afternoon crash. Between cases, you'd find her chasing a rare Pokemon or engaged in fierce battles with our intraoperative nerve monitoring team on Pokemon Go. She loved to travel, but lived by the philosophy that if you arrived at the gate even a second before the doors closed, it was too early. She had a treasure trove of dirty jokes she loved to share with unsuspecting audiences, and her mood on Monday mornings was often predicated on how the Aggies played on Saturday. I was supposed to operate with Lynda the day she unexpectedly passed away. It was one of the most devastating days of my life. When I first met her, I was a second-year resident who had no clue what I was doing with my life or career and definitely didn't know anything about peripheral nerve surgery. But Lynda had an enthusiasm that was infectious and a magnetism that drew me to her. Somehow, she saw something in me and, with great care, patience, and hours of operating together, nurtured that something into my deep passion for peripheral nerve surgery. How could I go on without her? And then something shifted. I'm sure many of you have experienced this phenomenon. As I started my first nerve case after her passing, I suddenly and startlingly heard her voice clearly in my head, as if she was narrating the operation. The countless pearls and tips she had spent hours teaching and reteaching me. You will find the C5 nerve root where the phrenic crosses the lateral border of the anterior scalene. If you can't find the biceps branch of the musculocutaneous nerve, you need to look more proximal. And my personal favorite, and something that has gotten me out of trouble many times, if you think you have discovered a new anatomic variant, you're wrong. Just keep looking. I realized then that Lynda lives on. She lives on through the fellows she trained who are treating people with peripheral nerve injuries throughout the country. She lives on in the countless residents she taught every time they appropriately pad and position a patient, or when they remember to test foot inversion and eversion on a spine exam. She lives on in the lives of the hundreds of children and thousands of patients that she cared for. She lives on in the brachial plexus program at the University of Michigan, which continues to thrive. And she lives on in her nurse practitioner and best friend, Mariana Papadich. Without Mariana, Lynda could not have done what she did. Mariana is here today, and I want to personally thank her for her unending support of Lynda. We can't bring Lynda back, but we can make sure that her way of doing things becomes the standard. So my ask for all of you today is simple. Be a little more like Lynda. Find that lost, struggling resident and show them the ropes. Step back from the podium every now and then so that your mentee can step up. Hold your teams to fiercely high standards, but remember to bring the donuts. It is the honor of my life to keep trying to make Lynda proud, and I invite you all to join me in paying her legacy forward. Thank you.